Hey guys, Alexis Pena here. Doing my second follow-up, if you will, on my ulnar nerve release with transposition done on my elbow. Last time I uploaded a video, I believe it was Monday. Today is Friday, September 12th. Um, Basically what I did today was 6 days after my surgery. I went in, got my stitches removed, and got some butterfly stitches on. Which come off on Monday. Once I'm able to wet it and stuff. As far as my range of motion goes, I can move it front and back a lot easier than I could a few days ago. Full range of motion, like last time, but lot less stiffness and pain. Still having to do my everyday stretches, my up and downs, I guess. Behind the head, up here, forearm stretches. And then my nerve gliding exercise, which is when I have my hand up against a wall and then I look away to kind of stretch that nerve. Um, well, the doctor gave me some instructions on some updates, so I'll kind of go through those as quickly as I can. The first one is a scar massage and silicone instructions. Sorry about the beard, I look homeless almost. But 2 weeks after surgery, which would be next Friday, I can start doing my scar massage and silicone instructions. Basically, for the scar massage, I'll be using a small amount of greasy hand lotion or oil over the scar, and using my fingers, I'm gonna push deep and move in a circular motion over the scar and surrounding area. It says to avoid friction, move the skin with the finger. It'll most likely feel uncomfortable at first, but the more you use it, the more it'll desensitize, and the more you do it, the less it'll hurt, basically. And I'll be doing this 3 times a day for several minutes. Basically, how she explained it to me, let's say I have my incision right here. Basically, what I would do is with my fingers, I would get some lotion or oil or something, and I would use my 2 fingers, push deep, and then in a circular motion. No up and down motions, just basically, circular motions. Um, then for the silicone gel use, it's basically about a thing like that, silicone that she gave me to put on my elbow. Says to place the silicone gel over the scar and hold it in place with an elastic bandage or splint. It doesn't have to be tight, it just has to be held in place. You need to wear the silicone only at night. Wash the silicone gel every time you remove it with liquid hand soap and water and dry it. These are basically, I'll have to do my scar massages and gel for about 3 months until the skin feels normal and it's not red or pink. Basically, I think what the gel does, it flattens the scar, is what my physical therapist told me. Put it on there every night before I go to bed. Wash it like the instructions said. Now, as far as when I'll be able to throw and stuff, my doctor gave me this very doctor-ish handwriting, I guess. Kind of impossible to read. Good thing I was there while she was writing it. Basically, the first thing it says is 1 month to heal. I can start throwing it in 1 month, which is awesome. But yeah, basically 1 month to heal. Until then, once I can start sweating and stuff like that, I can start working out legs, my core, shoulder exercises. But she doesn't want me using any free weights for the shoulders, I guess. And she wants to avoid anything that, for example, shoulder presses, anything that involves bending at the elbow. But I'm sure I can do, straight arm raises, forward and to the side. After the first month, I can start, with 5 to 10 throws. And she wants me to work on these slow, work on perfect form every single time. And once I'm done throwing, ice and anti-inflammatories. Every single time I go to throw, if I had no pain, I can increase the workload by five more throws. Basically, let's say I start at 5, 10, then 15. Let's say I feel a little bit of discomfort at 15. She doesn't want me to stop altogether. She wants me to continue at 15 until I can get there without any pain, and then once that happens, increase the workload a little bit. Um, so she wants me to slowly advance to 50 throws, I'm sorry, with perfect form and no pain. And she predicts that this will take about 2 months. So 2 months working on nothing but perfect form. She doesn't want me throwing very hard. And then after that's up, on the third month, then I can start working on speed. Again, start with 5 to 10 throws, with a lot more effort into it, till I work my way up to 50. And then she said that I should be at play level by the end of December. So basically, we're in September, all of September, October, November. Mid-December, it'll be 3 months. So by the end of December, I think I should be pretty well, underway to being as close as I'm gonna get to where I left off before I got injured. Then I have to, hopefully by then I'll have a few bullpen sessions in. I have bullpen work, heavy mechanic drills, and just trying to get myself in the best shape possible for this upcoming season. Let's see. I will most likely have an update for you guys on Monday after I get these stitches removed, and then see how my elbow feels and see if I can start working on any other drills and whatnot. Hopefully I will start physical therapy on Monday with the therapist up in Quincy, Illinois. Not sure who that's going to be yet, but I have a place in mind, and I got to give them a call tomorrow and see kind of where we're at and what we can do. But yeah, thanks again for tuning in, guys. I'll see you guys on Monday.